Bonjour.
Hello, and welcome to this press conference from the Minister of Public Health and Social Services, Christian Dubé, concerning the epidemiological situation having to do with COVID-19 in Quebec. I am Rebecca Sonosima, Press Secretary of the Minister of Health. Today, the Minister is together with the Strategic Medical Advisor for Public Health, Dr. Yves Jalbert, as well as the Strategic Advisor on matters related to COVID-19 in Quebec, Ms. Caroline Roy. Without any further ado, Mr. Dubé, the mic is yours. Thank you very much, Rebecca, and hello to everyone. I hope that everyone has been having a very good summer. In this vacation period, I am together with the two people that Rebecca had just introduced, and I really appreciate the presence of Ms. Caroline Roy. Thank you for making yourself available today in Danielle's team, but also Dr. Jalbert. Perhaps you don't know him as well, but he's in Dr. Arruda's team. Thank you to both of you for being there today during this period of vacation. So I will start with the epidemiological situation. I have a good idea that Quebecers are perhaps not excited to hear about COVID in the middle of the month of August. Unfortunately, the virus itself is not going on vacation, and we have to prepare ourselves for back to school, but also when everybody will be back from vacation, when people will start going back to the office. So we have been able to see today, and in the past few days, an increase of cases. And also, unfortunately, particularly today, there's an increase in hospitalizations. I believe that we truly have to be we have to follow this situation very closely, and I will be coming back to a few elements. And I'd like to say that today, taking into account the situation, today will be the return of press conferences on a weekly basis. I would say too bad for you, but I think it is important to be able to do this on a weekly basis now. Not only is the epidemiological situation marked by an increase of cases, and has been in the past 2 weeks, but important cases of the Delta variant in Quebec, as you can see in the executive summary that we publish every day. And Dr. Jalbert will be able to give you more explanations if you have questions on the presence of the variant. But particularly as we look at what is happening elsewhere in the world, in the U.S., where we're following things very closely, but also the United Kingdom and in France, the Prime Minister said it last week, a fourth wave is inevitable in Quebec, unfortunately. The Delta variant is dominant in most of those countries that I just talked about, and Quebec, despite all the work that has been done in the past months, will not be able to escape a fourth wave. What we are wishing for, however, is that the wave create as few damages as possible, most particularly in our hospitals. That is why we are insisting so much on the vaccination of the greatest number of Quebecers as possible. And that is what will allow us to control a fourth wave and to minimize the impact on hospitalizations and deaths, as we've seen up until now. Now, we know that although the vaccines do not protect you 100%, they are still very efficacious to prevent people from falling ill. And even if there may be significant side effects, they are still quite rare. So the risk of being severely ill because of COVID are a great deal more or severe than any risk presented by the vaccination itself. Quebecers, therefore, have to continue getting vaccinated. And I absolutely wish to put the emphasis on the fact that amongst eligible Quebecers, eligible to vaccination as of today, 84% have received a first dose, and also very important, 70% as of today have received a second dose. So, a few numbers. I know that some are following us very closely with these statistics. What we're missing is 400,000 second doses to get our initial objective of 75%. of fully vaccinated people in every age category. So that is quite a success already. We have vaccinated 6.3 million people with a first dose. That is what represents the 84% that I was talking about earlier, and 5.2 million with the second dose, which represents the 70% that I was talking about just now. But now, to make sure that everybody who has received their first dose gets the second, we are therefore missing 1.1 million people that should be vaccinated by the 31st of August. That represents about vaccinating over 1 million people over the following 20 days. But what is important is that 1.1 million that we're missing is also going to allow us to reach 84% of the eligible population who will have received 2 doses. If we reach those objectives, and we're very close to that, we will be part of the most vaccinated places in the world. And we can be proud of the work that's been done by everybody, not only by Quebecers, but by our teams, our vaccination teams, and our health network. I would say that it's important to go over 80% and even to beat our present 84% because the Delta variant, it has been said, but it has to be repeated. It's more dangerous, it's more contagious than the variants of the preceding waves. So I want to reiterate, it's already fantastic that the number of vaccinated people is at this level. And even in young adults, we've been talking about it a lot, the category of 18 to 29 years of age who are not as numerous to have gotten vaccinated, but we have reached over the past few days, and you can see it on our statistics, we have now reached in those age categories 7 out of 10 Quebecers who have been vaccinated. The good news, however, is that for the past week, there's another 8,000 to 10,000 people who have made appointments in every age category to get a first dose. So the effort of being able to go beyond 84% is still very possible over the following weeks. I find that it is very encouraging for our teams, very encouraging for public health, but we have to continue because vaccination is truly a key element in our success. Now, you wanted to hear about the vaccination passport. Here's where we're at. Even though we are going toward a vaccination rate amongst the highest in the world, as I was saying, it still leaves a lot of unvaccinated people around. And for us not to be forced to bring another lockdown, and we've seen it. We've done it 3 times with 3 waves. And if we don't, we want to avoid having to close down businesses. The best way is vaccination. But also, to avoid a further lockdown, we will use the vaccination passport. And remember, I was here a few weeks ago, and we had said that we would apply the vaccination passport on the 1st of September if and only if the situation were to deteriorate. That is the agreement that we had, that we took with Quebecers. Taking into account the increase in cases that I was talking about earlier on, the increase of the variant, the fall coming up with the back to school and back to work, and the prevalence, the expected prevalence of the Delta variant, the conditions are there to deploy the vaccination passport, as the Premier announced last week. The vaccination passport will be implemented. Now, we also wish to do things gradually taking fully advantage of the following weeks before back to work and school so that we are going to be well prepared for a rollout of the vaccination passport in an organized, coherent way. Our objective is that the vaccination passport allow those people who are adequately vaccinated to have access, and I want you to listen to these words, to have access to public events where there's a lot of people and to those activities that we call high contact rate, high socialization rate. So for those activities and services that are non-essential, please listen to that. To be noted that for the time being, the vaccination passport will not be applicable to retail stores. Now, What do we mean by public events with crowds? Here we're talking about festivals and inside places with high capacity. But for activities with high rate of contact, what does that mean? Well, places with a lot of socialization, bars, for example, restaurants, or training facilities. Those are the two main categories. The idea is a very simple one, is what we've said already. The idea is to give access to those people only to those who are fully vaccinated as of September 1st, instead of closing them down and of being forced to lock them down, which is what we did in the past 3 waves. Now, that is for where it's going to be applicable. Those are the greater principles. So that we prepare ourselves well over the coming weeks by the 1st of September, we are going to be starting tests of QR codes with pilot projects. We've already had apps with our employees and our departments who are already very advanced. However, we are going to be rolling out this week a first pilot project that I'm still calling la cage au sport, but it's called cage brasserie sportive. As of tomorrow, that is the 11th and 12th of August in Quebec, we're going to be making tests over 2 days with their agreement, and we really appreciate the work that's going to be done with them, to test out both the app, here's my phone, the app itself, because there's going to be an app to read the code for the retailers and business owners, but also one for clients who want to make sure that their codes are recorded properly. So the first pilot project will be this week with the entire team working for Daniel Paris, and Caroline is ready and will be able to answer you. I think that they're really looking forward to starting next week or tomorrow. Next week, we're going to be doing with the gym. On the 17th and 18th of August, we'll be doing it with the gym. Econo Fitness in Laval is the one that we're going to be using. Vimont à Laval. Econo Fitness Vimont in Laval on the 17th and 18th of August. And in the discussions that we've been having over the past few hours with many merchants and shopkeepers, there's even a bar owner who are very advanced, who would be interested in doing a test over the next few weeks. It goes to show you the positive aspect of business owners who wish to participate in these projects. So very good news that we've learned over the past few hours. So these 2 or 3 pilot projects are going to be able to allow us over the coming weeks to bring the necessary adjustments to the application mechanism and also give time to those places that are targeted by those vaccination passports and, bars, gyms, restaurants, but also to theater rooms, festivals, to be able to see how the app is going to work and how it can be adjusted over the upcoming weeks so that it is ready on the 1st of September. Now, as I speak of the importance of doing things properly and of being ready, I'd like to remind you that pilot projects are going to allow us to, fix and adjust business rules. And when I speak of that, there's going to be an app like this one here. You can see a little bit, you recognize the colors, yellow that we see in the government's advertisement. So this app is very simple. There's going to be an app for reading for business owners who are going to have, and that's what we'll be testing over the coming weeks. And there's going to there's also going to be an app for Quebecers, an app such as this one. These apps are going to be available on every platform to be downloaded. Most people are familiar, like App Store or the Google Store, or even on every single generation mobile device. The app will be entirely free for Quebecers. It must be a business owner calling me. Sorry about that. So The app is going to be entirely free for Quebecers, for business owners, and for owners, generally speaking. I'd like to remind people who perhaps don't have a smartphone, because we have seen it since we made the QR code available on the portal. It is also going to work with vaccination proof that is printed, so paper. So there are people, and we understand very well that not everybody has a smartphone. Those people have already received, if they ask for it, a QR code as a paper version. They can get it in the mail, and it will be up to them to present it at the time that they go to one of those businesses in question. On the week of the 23rd of August, we are going to do exactly as we're doing today. We're going to have a press conference, and we'll indicate to you clearly when and how businesses will be able to get the app and all those different things. So we're very advanced in this entire thing, but also the list, an exhaustive list of the targeted places. So I'm giving you the two main categories up until now. There will be discussions with associations of business owners. There are even some that want more than we do to have this. But we wanted to make sure that we got through our pilot projects before broadening the number of people taking part in it. The discussions that we've had in the past few hours with the different associations is something that we will continue doing, because we wish to set something up that is very flexible, that allows companies to do it efficiently, and for the places that are being targeted, there are teams from the department who have done fantastic work until now to prepare themselves, will accompany them. And I'd like to remind you, we're talking about a vaccination passport or vaccination proof. We've been talking about this since the month of April. And I would say that we are very happy with the way that people have reacted with vaccination, and also very happy with how they have reacted to the vaccination passport and the QR code. And I'll give you a statistic. Earlier on, I told you that 5.1 million people got a second dose. We have over 90% of those who got a second dose who asked for their QR code. So we already have 4.7 million people who have their QR code in hand. And we're not even at the end of August yet. So these people, once again, I do want to mention it, got it either in digital format or paper format. Now, the fact that we have 4.7 million Quebecers who are adequately vaccinated, I think that the next step is to make sure that as many people as possible, because there are some people left who will be getting vaccinated, that they download their QR code. I said that 90% of people have done it, but I find important that all those who will need it to go to those non-essential services be able to get their QR code. And I'd like to remind you, there's also going to be phone support if ever you have any problems. Danielle was telling me that up until now, we have been able to fix everything with people who had problems. But if ever anybody else encounters a problem, there is a phone line that you can call. To conclude, we are following the situation, the epidemiological situation, very closely. We're following our game plan as well. We are doing things in the right order. We are therefore taking advantage of the upcoming weeks to finalize the technical aspects of the app, of the passport, in order to be ready to have it roll out in September in collaboration with the different economic sector associations. And I wish to repeat, I invite Quebecers who have not yet done so to take advantage of the rest of the month of August to go get their doses of vaccine. Let's be very clear. Don't wait to hit a wall in September. Get vaccinated, please. And if your appointment for the second dose is after the 1st of September, try to go earlier. We understand, and I've said it on social networks as well, there are still people who are vaccine hesitant, and we will continue informing them of the risks, but also the advantages of getting vaccinated so that a greater number of Quebecers, as great a number as possible, be vaccinated before we start with activities in the fall again, which is usually has seasonal increases, as we saw last year. Let's remember that risks are linked to the vaccine are really not as significant than those linked to COVID-19 in people who are non-vaccinated. Our objective with the vaccination passport is to not go back to a generalized lockdown. And at the same time, we wish to avoid overcrowding our hospitals. We cannot allow ourselves to have to delay operations and other procedures again. So we are wishing to reach a balance to allow those vaccinated to get wider freedom, keeping the economy open and protecting everyone's health. Thank you.
Today marked the returns of the press conferences every week. The epidemiological situation is marked by an increase in cases in the last 2 weeks and an increase in the presence of the Delta variant in Quebec. We vaccinated so far 6.3 million people with a first dose and 5.2 million with a second dose so far. To make sure that everyone will receive a first dose and get a second one, we are missing 1.1 million people to be vaccinated by August 31st. This will allow us to reach 84% of the eligible population who will have received their 2 doses. And even if we are heading towards one of the highest vaccination rates in the world, it still leaves us with a lot of people unvaccinated. So that we do not have to reconfine and to avoid closing activities or businesses, the best way is vaccination. But we will also use the vaccination passport. Our goal is for the vaccination passport to allow adequately vaccinated people access to high-traffic public events and high-contact rate activities that are places of great socialization for non-essential activities and services. This is why we will start this week testing the QR code application with pilot project. So we will be deploying a first pilot project at La Cage Brasserie Sportif in Quebec City on August 11 and 12. And in the following week, we will be at a gym, Econo Fitness Vimont in Laval, on August 17 and 18. These 2 pilot projects, and maybe some others in a bar that offered themselves this morning, we will allow us to make the necessary adjustment to the application mechanics and to give the businesses covered by the passport the time to prepare for September 1st before making the application available to business and customers. When deployed, the reader application that will be available, and you can see a picture here of what the application would look like. It will be available on the App Store, Google Store, and mobile device of all generation. I remind you that the application will be completely free for commerce and for users. It will also work with the vaccine proof of paper if people are not able to use their phone for it. It will be delivered by mail, as we have done for the QR code. In the week of August 23rd, we will update you on this subject and will make it clear when and how businesses will be able to get the app, as well as the full list of targeted places. In conclusion, we invite Quebecers who have not already done so to take advantage of the rest of August to get their 2 doses of the vaccine. Remember that the risk of the vaccine are much lower than those of COVID in unvaccinated people. Thank you. Merci beaucoup.
Merci beaucoup. Alors, nous allons maintenant procéder à la période de...
We will now proceed to the question period.
Donc, j'invite les médias francophones à se diriger vers les micros. Comme à l'habitude, ça va être une question.
Explanation of question period.
Par média, s'il vous plaît, précisez votre nom et votre média. On va commencer avec le micro 1.
Oui, bonjour, Éric Martel.
Hello, Éric Martel. I was wondering what will be done for those Quebecers whose medical condition prevents them from getting a vaccine. A very good question, because the first version that we will be making available for the 1st of August will not be able to take into account yet those people who have a medical condition. We are having discussions right now so that the second version, there will be a few updated versions throughout September, will be taking that into account. Will we need a doctor's note? Earlier on I was talking about the business rules or the general rules, so we'll take that into account. We're having discussions right now, but it is public health because we don't want people to arrive with a doctor's note at the restaurant. We're agreed on that, so we're going to have to find a way. But in the short term, the first version will not have that possibility, but there will be an adjustment brought quickly. Am I forgetting something, Caroline? Nope, that's fine. All right, and you talked about restaurants. We know that there's a lack of workers already. Do you think that certain establishments will have a hard time mobilizing the staff for that? Well, listen, the reactions that we had up until now, and that is why I have people at the cabinet and the department who have made calls. I think that people really appreciate that we have this period of 2 weeks to see how, on a practical basis, things will be going. That is why we're starting tomorrow. The reaction to date is very simple. As I said, everybody is, we took what was the easiest by taking that code that is available at the international scale. I think that what people will decide, and that's we are attempting with the casual sport, is to know, are we doing it at the time when people pay? Are we going to do it, as they come in? We're going to check what the mechanics of that is. But up until date, the reaction is very good. But we want it to be as fluid as possible. And we wanted, we're a little bit, once you're paying or you're making a reservation, has all of that already been done? That entire mechanical aspect, I wish for us to look at the results of the pilot project over the following 2 weeks. Thank you. Next media. I have a question on how all of that is going to be applied in schools. What tools are we going to be giving at every level? There's a lot of questions as well, questions being asked by what is going to be defined as an extracurricular activity. How does that apply? Well, there are many elements to your questions. So first, my colleague Jean-François Roberge is going to do a press conference tomorrow specifically for the back-to-school part. We, in the meantime, I would like for him to answer those questions, but we also want to make sure, amongst others, I'm thinking about the entire question of extracurricular activities, high school and all that. There are so many elements in that I would prefer for Minister Roberge to answer that tomorrow. What we wanted to do is a lot, to give the greater principles for business owners, because that is where the most work, the mechanical work, is going to be done. So I think that Minister Roberge tomorrow is going to take all the necessary time to be able to answer that. We can see, I'd like to remain in education, but we can see certain universities, like Ottawa University has just done it, is starting for vaccination to be mandatory. In Quebec, we know that it's being discussed. What do you think about that? Is that something that right now you are encouraging? Well, as I answered earlier on, of course, we're having a lot of discussions, both with Ms. McCann and with Mr. Roberge, on how the back-to-school is going to take place. I would like to wait for the presentation to be done to give you all the information on that. But of course, right now, and I don't know if Dr. Jalbert wants to comment on that, but we are basing ourselves a lot on the recommendations of public health, because the epidemiological situation, as I'm saying, can vary a lot over the upcoming 2 weeks. We saw that we went up to 200, 250, 300 cases or more tomorrow. We have to remain flexible. So what we were thinking a few weeks ago, it's been 18 months that we've been saying that, it can change. So I prefer that public health tells us a little bit how the epidemiological situation is going. Dr. Jalbert, did you wish to add something? Yes. Mr. Minister, we did notice over the past few weeks that there was an increase in cases pretty much everywhere. There's not a lot of regions that are not affected. We had 250 cases per day, more or less, and it's increasing. And on top of that, we have the variants that are more and more present. The Delta variant is at about 30%, about a third of our cases right now, and we are planning to reach half of our cases that will be Delta variants in the upcoming weeks, probably. So what we are announcing today could change a lot over the upcoming days or weeks. If we can confirm that we really are the beginning of a Delta variant wave, that will bring us in front of a very different situation from the preceding waves. So we can't be surprised if over the upcoming weeks we have other positionings. Thank you. Could I add something? Yes, certainly. That's what you're there for. What I'd like to add is that we're very active as well with school boards. So right now, our public health teams is entering into contact with each university, college, high school to agree on vaccination profiles for that group. So there would be mobile clinics in those establishments. There will be agreement to move the students around. So we're very active for the back-to-school period with each of the school establishment.
Oui, bonjour, Valérie Chouinard pour TVA Nouvelles. Bon, à partir du 1er septembre.
So as of the 1st of September, we'll have to be fully vaccinated to go to a gym or a restaurant or all that. People who work there, will they also have to be fully vaccinated? The answer for the time is no. There really is a difference that we're making between a client and the employee. There are very strict rules as far as the work code, the labor code, where working is a right. But for the time being, and I wish to repeat that, for the time being, taking into account the health guidelines that will be kept in restaurants, employees will still have to wear masks and all that, we believe, for the time being, as I repeat, that we can continue keeping restaurants open with, I hope, as many vaccinated employees as possible, but we cannot require it, let's be clear. And it is coherent because if we look at other sectors, we don't here have a clientele that is vulnerable. We agree. And we have an environment where people are seated. So I could give you a whole list of reasons. We did study it, but we made sure that we were going to be treating clients one way and employees another. But what we've heard, and after having spoken with a few restaurant operators as well as bar operators, it is excessively difficult for them to find workers, but at the same time, those employees very often are also clients of restaurants and bars when they're finished. And for them to go to those places as a client, they will have to get vaccinated. So I think that we are going to be finding that balance over the upcoming weeks, but for the time being, we will be respecting the rules as we've always done. Second question, I'll piggyback to what my colleague said. Through the obligation of getting vaccinated, we know that there's been discussions for healthcare workers. Should they be forced to be vaccinated? Has that decision been made? If so, when could that be done? And also, might they also have to get vaccinated? Well, let's go with healthcare workers for now. Obviously, we're thinking about it right now. We have not finalized our decision. I would like to remind you that I had kept you informed. For the time being, we have about 90% of our health care sector employees who are vaccinated. That's very good news. However, we still have a category of employees, for example, placement agencies, external agencies, workers, for example, who are intermediary resources. So for us, taking into account the fact that I talked about earlier on of vulnerable clients, for us, it still is an issue. And over the upcoming weeks, we'll have a decision to make together with public health on the vaccination of the healthcare sector employees. We're very happy to have reached 90%, but I can tell you that the context of the variant, and I've said it, everybody knows it, that variant is more contagious, it is more dangerous. So if there is an adjustment to be brought for healthcare employees, we will do it quickly. As far as the question of education is concerned, once again, that's another question, and I believe that one will talk about it with Ministers Roberge and McKenna will be able to answer that question. Thank you. I would like to know whether, since we know that the implementation of the vaccination passport, it does make people want to get vaccinated. After Mr. Legault's announcement yesterday, a lot of people got an appointment, but that stopped pretty quickly. So does it work? Well, there's two things. And if my colleagues wish to comment, they can. Two things here. If we compare ourselves to France, for example, when the announcement of the vaccination passport was made, their vaccination rate was not the same. There was more around 40 or 45%, depending on the dates and announcements. We were already at over 75% when we started talking about the vaccination passport. So I said it earlier on, every percentage point that we gain for us is important. And with the announcement made by the Premier last week, we were able to see, and I couldn't say it precisely, but it was between 8,000 and 10,000 people who made appointments for the first dose. For me, that's very good news. It means that after about 10 days, we added 1%. We were at 82% a few weeks ago. We're now at 84%. If things keep going well, and especially people see that we'll be ready to ask for the vaccination passport as of September the 1st. So yes, I think that we'll continue seeing an increase, but we have to, be aware of the fact that we are in one of the most vaccinated countries in the world right now. So of course, each percentage is going to allow us to avoid a death or a hospitalization. But we are on the verge right now. We're not, at 40%. As a follow-up, talking about France, we see that there's many cases of fraud of the vaccination passport. What are you going to do to avoid that here? Well, we have the opportunity of having worked on this for many months now in collaboration with our people from the Treasury Council who have a cyber security team. So I think that we have set up together with Daniel Barry's team. There will always be people who are going to try. And I think we have to be realistic. But I would say one thing, perhaps, Caroline, and I don't want to go into details too much here, but there will be, once we have presented the QR code, as we've said, and perhaps the best comparison that I could make is when you have your boarding pass, not only do you have to show that, and there's a code on it, but you also have to show your passport. So there is a combination of what is written in your name, what is written on your QR code, and you have to present your passport. At the restaurant, it will be the same thing. You will have to show your QR code, but the person could ask you to show your, driver's license, something with a picture to make sure that it is yours. So there will be people who will try to fraud the system. There are even people who try to fraud to get, a vaccination without having it. And we have good employees who said no. But I think we can do, we're going to try to do everything that we can to avoid that kind of problem. I'd like to know, you have not mentioned the possibility of implementing the vaccination passport regionally earlier than planned if ever there are outbreaks. There's the case of the Mauricie, for example, in the past few days. So have you put that scenario aside, or is there still a possibility of changing the implementation depending on the epidemiological situation, perhaps bring it earlier on? Well, listen, I will ask Dr. Jalbert to confirm, but for the time being, we want to go just in everywhere in Quebec because the variant is going so quickly and it's circulating so much that I think that it would not be logical, it would not be coherent to go regionally. For the time being, we're thinking about all of Quebec. Yes, we want to have a measure that is going to be applied everywhere. If ever we end up in a situation where there was something very complex, very serious, that perhaps we would be different, but that is not a tool that we are considering taking into account or using right now. In the past week, we also saw that there were a lot of outbreaks in places of work. A lot of employers are getting ready or have already started bringing employees back to work. Is that a possibility of implementing a vaccination passport? Could that become a public, could an office space become a public place? Well, I said it early on, but it's fine if I repeat it. There are very important issues in the labor code as far as the vaccination passport is concerned. I'm talking with the Minister of Labour right now. We're having discussions to see what can be done, but I believe that up until now, there is no consideration of making it mandatory. Now, how are we going to make sure that depending on how the situation evolves, the epidemiological situation, are there people who are going to want to continue working from home, etc.? I think that we have to leave the situation. There are many people who are looking forward to going back to the office in September, but I'd like to repeat it. Our main objective with the vaccination passport is to avoid a further lockdown. So as far as companies, will be following that very closely, but for the time being, it is not at all something that we're thinking about. And are museums part of what you were mentioning? I do not believe so for the time being, but we are in a situation where, no, I do not believe that museums are part of it for now, but it is the kind of thing that I would like to clarify. So when I put the two large categories, crowded places, maybe some museums have that, but let me talk about it again with public health and particularly with Minister Roy to give a more specific answer next Tuesday.